You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, we're talking about extreme smile makeovers. According to my first guest, he says your teeth can never be too bad to have the smile you've always wanted. We're talking about full mouth reconstruction today with Las Vegas dentist, Dr. Greg Hendrickson. Dr. Hendrickson?
Randy, how are you?
I'm good.
Glad to be here.
All right. Good. Now, I know you brought a lot of photos.
I did.
So we'll get to as many of those as possible.
Great.
Now, you have a pretty large practice. For people that don't know your center, I mean, who's the typical patient? What are the services you offer?
Oh my gosh, Randy, we have, it's myself, I have a team of 18 other just wonderful ladies who help support me. I've got 2 associates there. We cover every facet of dentistry. We do as simple as bleaching, simple general dentistry that my associates take care of. We offer Invisalign. We do porcelain veneers. We do smile corrections. We also do implants, which is an area that I really specialize in.
Yeah, who's the typical implant patient you see?
Anybody walking on the street, Randy, whether you're missing 1 tooth or 2 teeth or you need multiple teeth replaced, we take care of it. So we have a couple of different groups that we really see in our practice. We have people that have a lifelong problem of missing teeth, and they want to do what they can at this point to stay out of dentures.
Okay.
They want to get their mouth cleaned up. They want to return themselves back to a state of health. And then we have the people who have just let it go, and they're already in dentures and they're looking for alternatives. They also want to have their smile back. They want to have their life back. They want to be able to eat what they want to eat. The people in our community are very, very active. Okay? 80 is the new 60. It really is. People are living longer. They're being active longer. You know, all these retirement communities have senior centers where people are going to work out. They're taking care of themselves. And for a lot of these people, their mouths are the last thing that really needs to be addressed.
And you see reversals all the time. You say it's like extreme makeovers.
Oh, it's beautiful. I mean, these people come to us with all these problems, and we're able to save the teeth that are still healthy and rebuild their smile. We rebuild their confidence. We give them back what they've been missing for 20, 30, 40 years. They can eat whatever they want. They can go out and do activities. I have one lady in my practice that was scared to go swimming for fear of spitting out her teeth in the pool. And now she does everything. She plays tennis, she swims. She is probably one of the most active 80-year-olds I know.
Okay, now you're a dentist, so you probably think the teeth are the most important thing, or one of the most important things. You
know, most of the studies out there show, Randy, that the first thing people notice about other people is their smile, okay? You can tell if somebody has a nice smile. They bring it to the room when they walk through the door, okay? People who walk in and say hi, they're ashamed. They have something going on there, okay? They've lost their confidence. They've lost their zest for life.
You say losing teeth is expensive because you say the dentistry is somewhat divided. Some offices you say, and I don't want to put words in your mouth, I'm paraphrasing slightly, but when you have bad teeth, they may remove all the teeth and give them implants. You say that not everybody's ready for that.
Not everybody's ready for that.
Elaborate.
I had one patient who walked in and he had gone to one of the leading clinics in the city that they specialize in implant fixed dentures.
Okay.
And he went in there and he wanted to find out his options. And he got one option. That one option was to remove, he had 8 remaining teeth up top and 8 remaining teeth on the bottom, and they were healthy. He did not want to have all his teeth removed. He wasn't looking for the cheapest fix. He wasn't looking for the fastest fix. He just did not want to lose his teeth. And after looking at taking a CAT scan on him, looking at his teeth, he didn't have to. We were able to give him back his life that he wanted by just doing single tooth implants in the back of his mouth where he's missing his molar teeth. It was really simple.
It's a lot less expensive to do it that way.
Considerably less expensive, more predictable, faster, and the patients are happy. They have their life back.
Now you do a lot of these single tooth implants. So people, I guess how it's normally done, correct me if I'm wrong, you go to one place that does the surgery for the dental implants. Then you go to another doctor that puts the teeth on top, and maybe somewhere else for the imaging. You do it all right there.
We do it all right there. We have our own CAT scan that we're able to evaluate every single patient for. I've had years and years of training, and I'm kind of a control freak when it comes to this, okay? Because you know what? I want to put the implants where they're supposed to be. I want to put the teeth in on top of the implants how they're supposed to function. Okay? I tell all my patients that implants are the most predictable, longest lasting thing we do in dentistry today, bar none, done properly.
So it is like getting your teeth back.
Absolutely. It's better than getting your teeth back because they're not susceptible to tooth decay anymore, and they're not susceptible to periodontal disease anymore.
But if you're only missing one tooth, why get a dental implant over a bridge?
You know what, Randy? Bridges were great in their day. And my dad was a dentist, and he started in practice in 1964, and bridges were state of the art, okay? But we didn't have anything else. The only other thing we had before bridges were something removable.
Okay.
So then we went to bridges. The problem with bridges is that you have to grind down two perfectly healthy teeth, and statistically, they've got a 25% failure rate after 5 years and 50% failure rate after 10 years.
So they don't last very long.
They don't last very long, and typically when they do fail, we end up losing more teeth.
Okay.
So it just doesn't make sense.
So the answer is what? If you're only missing one tooth?
The answer is a single tooth implant. The most predictable thing we do out there.
People don't like going to the dentist.
No.
Do you still hear that, by the way? Like, no offense, doctor?
Every single patient that comes into my practice does not want to be there. Unfortunately,
what do they say to you? And do you have a funny line after all these years?
You know what? I tell them I don't want to be here either, but we both need each other. So let's just start the dance. Yeah, but every single patient comes in. They don't want to be there. The patients whose teeth are really bad, it's really sad. They all have this history of some kind of a traumatic experience as a child or a young adult with the dentist. And, you know, so for them to finally come into the office, you know, some of their stories bring tears to my eyes because, you know what, they've just lived in pain and tried to hide this embarrassment for so many years. And it's finally, for some reason, something happened in their life that they finally said, you know what, I gotta fix this. I gotta get this done.
Good.
And you know,
like they're getting married, daughter getting married,
yeah,
divorced.
or just, you know what, they just had pain, they're tired of the pain, they're tired of not being able to eat, they're tired of when they do eat, they're in pain, they're tired of their gums bleeding, you know, their bad breath, whatever it may be, you know, something triggered it. And, you know, I'm always humbled by the fact that they came into our office. I personally think it's the smartest thing they ever did, but you know, it's great to be able to take these patients who have been just crippled in life by their dental disease, and we're able to completely turn them around. And once we get to the point where they're healthy again, they're a different person. They've got their life back. They can do whatever they want. It's life-changing for both them and myself, and my whole team would agree.
Okay, you brought photos. What do we look
I did. Well, this is the first one I got. This is Dolly. Dolly came to me, and you know what? That's all the bigger Dolly would smile.
That's her smiling.
That's her smile. And we get that a lot with these patients, Randy. They come in, they're talking like this.
Even to you as a dentist?
Even
they're
to
covering
me.
their mouths?
Even to me. You know what? Sometimes we have to stand behind these people to get them to laugh for the camera so we can get the records for the pictures. And it's difficult. I mean, they're just living these years and years of pain and sadness in their mouth. Okay? So that's Dolly's smile. Okay?
So she comes in, like, what do they say?
She comes in, she's had enough. I believe she had an event coming up with a daughter graduating from college, and she just wanted to be able to enjoy life again. And she didn't want to have excuses. Okay, they were going to be going out to this big dinner, and she wanted to eat what she wanted to eat. So she had a really broken down set of teeth. And this is what we did. We took her to that. And you know what? That smile didn't just happen. We designed that. And if you look at the teeth, the way they follow the curvature of the lips, I mean, we go to these great extents. We look at every single detail with these patients.
They look real. When they look real.
They are real.
They're her teeth.
They're her teeth. She can eat with them. She loves them. She comes into the office and lights up the whole office when she comes in for cleaning and checkup. And she loves to talk to the patients now about what she's gone through and the transformation. Yeah, she just loves to share her story.
At the top of the show, we said you're never too far gone. But what if people have really bad gums, like bleeding gums, and just, they can still do this?
They can still do this. There is not one single patient who is not a candidate for this.
Now these people, because we talked, a lot of people haven't been to the dentist in 10 and 15 years, and they're afraid of the dentist, and you offer sedation.
We do.
Is that popular, the IV sedation?
You know what? I actually tell the patients, you know what? One of us is going to be sedated. Is it you or me? Okay? But it's very popular. I have patients that some of them I need to sedate just to get them through the door.
Really?
Other ones, you know what? Some of the procedures run kind of long. So you know what? It's just so much more comfortable for them. And it's very safe. We're monitoring them throughout the whole procedure. And patients just love it.
So what levels of sedation do you offer? So there's nitrous?
Ours we offer,
I've done that.
We offer nitrous, and then we offer the IV moderate, what's called conscious sedation. It's not general anesthesia. No, this is IV.
Okay.
Yeah, so it's very fast acting. It's very incredibly safe. And the people come out of it well before we're done, and they're able to walk out of the office, though we take them out in a wheelchair just for safety.
So somebody gives them a ride home if they have IV
Yeah,
sedation.
absolutely.
So when you say you can do like 6 months or a year worth of dentistry in just a couple of visits, it's because the sedation allows you to spend more time with them.
Absolutely. Absolutely. You know, it used to be, Randy, that we'd bring these patients and it would take us 6-8 months to do this work because we are only able to do a little bit at a time. Now with the sedation, we can have them in the chair for 3-4 hours, and they can wake up with a brand new smile.
Okay.
And that's huge.
And that happens.
That's the first thing we do is we put a mirror in front of their face when they're waking up and show them their new smile. That's huge. It's wonderful.
And what do they say? Is it tears or is it happy?
It's tears. You know what's really cool is not only has their smile been transformed, but all of a sudden they have a brightness in their eyes, and their whole face lights up. And that's when I know they're happy.
Okay, good.
That's cool.
More photos.
More photos. This is Scott.
Okay.
Scott is just a great patient. Scott came in and, you know, he shared with me that he has, I believe, 4 or 5 kids, and all of his attention has been towards work or the kids. And
that's him smiling, by the way.
That's him smiling.
Okay.
Yeah. Well, you know, that was his smile, and underneath there, he had broken down teeth, he had some missing teeth, and he was looking for solutions. So after the first appointment in one afternoon, we were able to give Scott his smile back.
Wow. I mean, he looks younger. I'm not trying to side with you. I mean, anybody, I think.
Well, they all look younger. I mean, you know, the smile just brightens up everybody. So another thing I want to talk about, Scott, was he sent me this beautiful text message about 2 or 3 weeks after we finished him. And he basically went on to tell me how we had given him his life back. And Scott was a very, very outgoing, gregarious guy. Just didn't smile. He's a VP of marketing for one of the major casinos in town. But he could talk, carry on, but he just never smiled. Well, now he says he can't walk by a mirror or a glass or any reflection without smiling. I mean, that's so cool.
And this was a guy that almost kind of, I mean, why did he put it off for so long? Was it a fear of the dentist or just putting it off like most guys,
Partly it was a
right?
fear, partly it was just, you know, life happened. You know, and for a lot of these people, it's not just fear, but, you know, life has been going on and they've been busy and other priorities. And it was just finally time. And this is Bev. Bev came to us.
You laugh when you show me these photos.
You know what? These people have been part of my life for years.
Okay.
And you know what? when they come into the office, when I see their pictures, I mean, I can recall everything we did for them.
Okay.
And it's just, it's life-changing for me as well.
Okay.
So yeah, it's cool.
So these teeth, what were going on there?
She had some missing teeth, broken down teeth, kind of crooked. Okay. So with a combination of therapies, we're able to give her the beautiful smile she always wanted. We replaced missing teeth. We changed out, you know, ugly teeth. We were able to straighten them out with cosmetic dentistry. It was just wonderful. And as you can see in the pictures, Randy, it's life-changing for these people. So Randy, but what I want you to really notice with Bev is look at the before and after. Look at the position of the teeth. Look at the number of teeth you see in her smile.
Yeah.
Okay. In the before, we show 6 teeth in her smile. In the after, we're showing 10 teeth there. Look how the new teeth follow the lower lip line. That's all by design.
You didn't get lucky on that one.
We didn't get lucky on that one. We've gotten lucky before, but no.
So was it designed on a computer or how?
No. This is designed. We go through several steps to try in the teeth. You know, try in with different temporaries, and we make sure that the teeth are the color, the shape, the size, the position, everything for the patient.
Okay.
These aren't one-size-fits-all smiles. Okay.
Now at the top of the show, we called it Extreme Smile Makeovers and Full Mouth Reconstruction. So I guess full mouth reconstruction is a dental term. So give us a working definition, because these are all full mouth reconstructions. What does that mean? So we know what that means.
Full mouth reconstruction basically means that, you know what, the people come in and what they have is broken down teeth, missing teeth, and we are addressing everything within their whole mouth.
Okay.
Okay? And we are rebuilding, replacing, reshaping, remaking, recolorizing, restoring their smile, their bite, their mouth to health. That's full mouth reconstruction.
Okay, good. Time for a few more photos.
Okay, one of my favorites.
Okay.
Rosalie came in and
Pretty nice smile.
she didn't like it,
Okay.
and that's why she came to us. She wanted brighter. She wanted there's a cant to her smile. The teeth tip off to one side. She wasn't happy with it. She wasn't happy with the function. She couldn't eat what she wanted to eat. Okay? So in a few short appointments, we're able to give Rosalie
Wow.
her, big wow. We were able to give her life back. And
So
you know
this
what?
is a combination of procedures like adding teeth, dental implants.
Right. Adding teeth with implants. Some of these cases we're using bridges, veneers, porcelain, whatever, the whole, everything we have in our arsenal to treat these patients, we're calling on. Okay? So it's not one size fits all. It's not come in and we'll take out all your teeth. We're going to save whatever teeth we can save.
Okay.
And rebuild around that. Okay? The cool thing with Rosalie, she told me afterwards, she is able to finally eat a sandwich again. That's huge.
Yeah.
Can you imagine that? I mean, how would you like to be able to go through life and not be able to bite into a burger or a sandwich?
Yeah.
Okay? That's life-changing. That's cool.
We take it for granted.
Yeah.
So they tell you these stories.
Yeah,
Like
all
they
the
tell
time.
you the eating stories.
All the time. Eating stories, going out with friends again, just smiling. They walk in and have this light in their eye.
Like it
now.
adds the charisma.
Absolutely.
When you have a nice smile.
Yeah, they light up. It does. You know what? And for some of these people, they joke to say that their smile gets into the room about 2 or 3 minutes just before they arrive. So, but they light up the room. And when you watch these people talk, so some of these people come in and they're there for a checkup and cleaning, and I see them talking out in the waiting room. And from a distance, I mean, you can just see them, the life in their eyes, and they're smiling and talking, and they're just so happy and proud of who they are and what they've done.
Interesting.
It's
Good.
cool.
Good. You like it.
I love it. It's my dream job. You know what? My wife will tell you that I don't go to work anymore. I love doing what I do.
You know, you told me on the phone, you said, I've never had to sell dentistry. What do you mean by that?
You know, there are a lot of gurus out there that will teach you how to set production goals in your office and how to upsell and
because those are the things we don't like about dentists.
Yeah,
I think at least.
Yeah, you know what? I treat the patients like they're my friends. They're my neighbors. They're family members, and I find out first and foremost, what do they want? Why are they here seeing me? Do they want a new smile? What bothers them about it? And then when I address their needs, and we look at their mouth, we look at their smile, and we give them options about what they can have.
So like maybe one might be a little bit more affordable,
Yeah,
one might be
absolutely.
addressing everything.
If you want to call it good, better, best, I like to think that whatever path we go down, that they're going to be very, very happy with it. My goal when I look at these cases is that, you know what, these people have had a life of problems. Some of these people have spent the past 15, 20 years in the dental office with patchwork, you know, bridges, fillings, crowns, root canals, single implants here and there. I had one gal who came in and she had 8 teeth remain in her mouth, and she had 13 implants placed over the past 15 years. And everything was in kind of a state of disrepair. And she just wanted it fixed, and she wanted to be done with everything.
Yeah.
So in one day, we were able to take out all of her teeth and 13 implants and give her the smile she wanted. I mean, that's huge. This is Dorothy.
Okay.
And again, this is Dorothy smiling. She
Do you
just
tell them to smile with their mouth closed?
No, I tell them, look, you know what? Open it up. Give me the biggest smile you got.
And that's
what I got.
What's a happy-looking lady?
She is very happy. But I tell you what, look at what happens when we give them what they want. Look at her eyes.
Another full mouth reconstruction.
Look at her eyes.
Yeah, yeah.
I mean, look at her whole face. They just light up. And it's not just the smile that lights up. Their whole eyes light up. Their whole personality comes out. These people, honest to God, they like lose 20 years. I mean, they're youthful again. It's beautiful.
Really?
Yeah. It's fantastic.
Do you think people, and at the top of the show we said you're never too far gone. So really, even if your mouth is a complete disaster, haven't been to the dentist in 15 years, you guys are equipped to take care of it.
Absolutely.
I mean, is that like your comment? Like, you seem to attract this full mouth crowd where they're, you know, like, as you call it, full mouth reconstruction, where they're really in bad shape and then they go to you?
I seem to. Sometimes I feel like that's all I attract are the more difficult cases that everybody has said that they can't be fixed. I had a lady in once that was told that she'd been in a lower denture for the past 40 years, and they told her she didn't have enough bone to do anything. And we're able to help her. Okay? Takes longer, a little bit more work involved with it. But you know what? We can help them. And they've lost all hope. Some of these patients have lost all hope by the time they're at my door.
Is that right?
Yeah. They've been told time and time again. And they've been told that implants don't work and implants are rejected and all these other fallacies that are out there. And you know what? In our practice, we have right around a 98% success rate over the past 20 years with dental implants. And that's above the industry norm.
Okay.
That's because we take great time in planning out how to restore these patients.
Now, what if you're only missing like a couple of teeth in the back?
Okay.
Why get an implant with those people?
Because those were the wisdom teeth and you don't need them.
Okay, but like just rear teeth.
So, you know,
why touch those? They don't show.
You know, the problem is that once you start losing one tooth, it can start a whole cascade, okay? Because then the upper teeth can start dropping down, the lower teeth can shift around, and then, you know, all of a sudden over time you lose another tooth and another tooth, and before you know it, these people come in and they're missing all their molars. Okay? Now they're chewing with their front teeth, which weren't designed to be chewed with. And so now their teeth are starting to splay, and, you know, it just starts this whole
So if you have holes in the back of your mouth, you believe, like, add implants in there to stop the tooth loss?
Absolutely. Absolutely.
Really?
Yeah.
Okay. So get an implant.
Get an implant. Absolutely.
Okay, good. More photos.
So this one is Joe.
All right.
And Joe came to me, and he had a lot going on in there with some bone loss and missing teeth and chipped and broken teeth. And he was just, again, looking for a long-term solution. He was on some meds that were having some detrimental effects to his teeth. So we wanted to rebuild him with something that would last him the rest of his life with the other health problems he had going on. And this is Joe after.
This is a full mouth reconstruction.
Full mouth reconstruction. And
Nice.
again, look at the smile, look at the lips, look at the eyes.
Yeah.
You know, it's life-changing. And you know what? These people, again, like I said, they're able to go out and experience life again. They're able to go out with their friends. They're not making excuses that, you know, they have to go home and take the dog out or anything like that. They go out, they live life, and nobody, you know, everybody looks at them and it's like, well, something's different, but what is it? And by the way, you have a beautiful smile.
Is that right?
Yeah, it's great.
So they get lots. So what do they like? The compliments or what they could eat?
Man, I tell you what, I have people that come in and want a beautiful smile, and we rebuild them, and they're like, Greg, I can eat things again. It's wonderful. And then they come in, it's like, you know what? I don't care about the smile. Those are the ones that scare me the most, because those are always the ones who come back and say, oh my God, I love my smile. And all of a sudden, their smile is important to them again.
Because they get compliments.
Yeah, they get compliments, and they're dating again, and you know, their significant other notices their smile, and you know, they just have a different outlook on life. And isn't that what it's all about?
We are out of time. Final message to somebody watching this. Maybe they haven't been to the dentist in 10 years or more. They don't like their smile. But for whatever reason, they're afraid to go to the dentist or afraid of the expense or whatever. What do you say to them?
Come by. Let's sit down and talk. There are always options, okay? If you've been told that you need to have all your teeth removed, come on in. There are always options. You may have teeth that we can save and rebuild and give you back what you're looking for. Okay?
Because we've talked in the green room. You said there's a lot of people out there with these treatment plans where all of their teeth had to be removed, and you say,
you know what, Randy?
They don't have to be all removed.
Sometimes people have a hammer so everything looks like a nail, okay? We try to look at every single patient as an individual. And if they have teeth that can be saved, we're going to save them, okay? I've had 20 years of experience in training to rebuild patients' mouths. And my goal is always to give them exactly what they want that has the best chance to last them the rest of their life, okay? That's my goal. And so I would encourage them, come in, meet the team, come on in, talk with me. I meet with every single consultation that comes in there. I want to hear your problems. I want to give you hope again.
And you're never too far gone. You have a great smile.
Never too far gone.
Okay, good. I want to thank you for coming on the show. Great stuff.
Thank you, Randy. It's been a pleasure.
Thank you. You've been watching the Wellness Hour, news that makes you healthier. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.